It's January of 2020. Somewhere in a CDC operations center in Atlanta, Georgia, a phone rings at 2 in the morning. A scientist picks up. The word on the other end is novel coronavirus, unknown transmission rate, spreading in China. We need you. What happened next, as you all know, is history. But here's what you didn't see and what nobody showed you. It was the people inside that building. The epidemiologist, the data analysts, the communications officers, the lab scientists, the CDC workers who became the first line of defense between the virus and 330 million Americans. Today, we go inside that job. Not the press conference, but the real thing. The impossible decisions, all the harassment that brought to them, the burnout, and the moments that made it all worth it. First, what is the CDC? The Centers for Disease Control and Prevention employs over 10,000 people across dozens of disciplines: epidemiologists, lab scientists, public health advisors, data analysts, communication specialists, policy officers, field investigators, and veterinarians. In normal times, before a pandemic that is, these workers just do normal things, or normal to them in their life, right? Which is tracking disease patterns, they investigate outbreaks, they develop vaccine programs, they study everything from foodborne illnesses to cancer clusters. But then the pandemic hits and everything changes overnight. Let's talk pay. The pay ranges from around 50K a year for entry level public health advisors to well over 150K for senior scientists and division directors. Most positions require a minimum of a bachelor's degree in health or a science field. Many senior roles require a master's or PhD plus years of field experience. The early days of a pandemic response are unlike anything else in public health because in those first hours, days, and weeks, you are operating on almost no information. A new pathogen doesn't come with a manual. You don't know how it spreads. You don't know how deadly it is. You don't know who's most at risk, and you have to make the public recommendations anyway. During COVID, CDC workers describe a surreal period in January and February of 2020, watching data come in from China, running models, trying to understand what the numbers actually meant, while the rest of the country was largely unaware. When the emergency declaration came in March of 2020, the pace shifted into something workers struggle to describe. The word they use most is relentless. Meetings at all hours of the day, data coming in from every state simultaneously, guidance documents being written, revised, and rewritten as new information changed the picture every 48 hours. And unlike most emergency workers, CDC staff aren't on the scene. They are the intelligence behind the scene. They're the ones whose analysis determines what the hospitals get told, what governors hear, what the White House is briefed on. The decisions in that building have consequences that ripple out to every corner of the country. During the height of COVID, a typical CDC epidemiologist day started before the sunrise and ended well after midnight, if it ended at all. Workers described losing track on weekends entirely. One researcher described researching for 90 days straight without a day off. The morning begins with an overnight data briefing. While you slept, if you slept, case counts changed. New variants were flagged. Hospital capacity numbers shifted in 3 states. You absorb all of this before your first meeting, which starts at 7 a.m. The meetings are relentless. Interagency calls with the NIH, the FDA, the White House Task Force, state health departments, hospital systems. Every group needs information. Every group has questions. And the answers are constantly evolving because the science is constantly evolving. The guidance documents are where the workers describe the most acute stress. Writing public health guidance in a fast-moving pandemic means issuing recommendations based on incomplete data, knowing that if you get it wrong, millions of people will follow the wrong advice. And then somewhere in the middle of all of it, you get a call from your child's school, or your parents need help, or you look in the mirror and realize you haven't slept more than 4 hours a week. The pandemic doesn't pause for any of that. Here's the thing that gets lost in the burnout statistics. Almost every CDC worker who survived the pandemic, and many who didn't make it through, say the same thing. They would go back because the mission is real. The caliber of colleagues is something workers describe with genuine admiration, working alongside some of the world's leading scientists and public health minds, people who choose a government salary over a private sector pay because they believed in the work. It creates an environment unlike most professional settings. And the moments of impact, watching a vaccine roll out, begin. Seeing case counts drop after guidance intervention, knowing that a recommendation you helped write reached 300 million people. Those moments are described as incomparable to anything else in public health. The CDC's own research arm, NIOSH, NIOSH, found that during COVID, 66% of public health workers surveyed reported symptoms of burnout. 66%. That's more than half of the entire workforce. And I'm honestly surprised it wasn't more than that. A 2021 survey of over 40,000 state and local public health officers found that 53% reported symptoms of anxiety, depression, or PTSD. A follow up in 2022 showed that number had barely moved. 48% were still experiencing mental health problems, even as the acute phase of the pandemic wound down. The harassment is something that shocked even veteran workers. Public health officials who issued mask mandates, vaccine guidance, and social distancing rules became targets. Death threats, harassment campaigns. Workers described checking their parking lots before leaving the office, changing their commute routes, moving their families. The funding and staffing situation is the structural problem underneath of it all. The CDC's budget relative to the scale of its responsibilities has been chronically underfunded for decades. When a pandemic hits, the agency is expected to scale from normal operations to a national emergency response with the same staffing levels it had during peacetime. Workers describe watching experienced colleagues walk out during COVID. Not because they didn't care, but because the institution didn't have enough resources to support them. And the tragedy is that those workers take years of irreplaceable institutional knowledge with them. So would they do it again? The answer from CDC and public health workers are more nuanced than a yes or a no. Here's what those workers want you to understand about the next pandemic, because there will be one. The question scientists are asked is not if, it's when. When it comes, the people who stand between that pathogen and the rest of us will be the scientists and public health workers, many of them working for government salaries in under-resourced agencies, carrying the weight of national decisions that most people will never know they made. They will be updating guidance at midnight because the data changed. They will be on calls with governors and hospital systems and the White House officials simultaneously. They will be getting harassed online while trying to save lives out here. And they will show up the next morning to do it all over again. That's a compressed version of what it's really like to be a CDC worker during a pandemic. Not the press conference, this is from the people from behind the scenes. And the next time an outbreak makes the news, maybe you'll know what's already happening inside that building and nobody's filming this. If you work in public health or if you work during the pandemic itself, please let us know in the comments how everything was. Although we already know what most experiences were like because we all kind of lived through it, it's very interesting to hear from people that did this in the real world. I would love to hear your story in the comments. And if you're interested in stuff like this, do give us a subscribe. Every week we go inside a different job that most people take for granted. Appreciate you for watching. Stay tuned for the next one. Peace.